Okay, I'm just going to get started if that's okay. Assalamu alaikum everybody, thanks for joining us once again. It's another MCS online seminar, and today we're going to run you through several things. Just basically to let you know, Brother Omar is going to be giving us an update with discussions he's had with the Scottish Government. We've also got a special guest tonight joining from the MCB, who's going to run you through some of the health and safety and risk assessment practicalities, as well as running through hopefully a Q&A session. What I would ask, just to make sure we kind of stick to a set agenda and a timeline, because I think as a community we're quite notorious for letting our agenda slip and our timelines run beyond what they should be. Could everybody, if you do have a question, can I ask that you ask a question in the chat, please? Yeah, or if need be, feel free to kind of use the icon to put your hand up to signal that you want to ask a question. But I'm going to ask again that you do make your questions short and sharp and kind of to the point, because I think last time we did kind of go off track with people kind of asking and kind of going beyond what the scope of the discussion was. So what I'm firstly going to do is I'm going to pass to Dr. Habib and ask that they do a Quran tilawat. So I'm just going to pass you over now. If you can just unmute yourself, Dr. Habib.
I think about Bismillah ar-Rahman ar-Rahim. First of all, I welcome everyone who have joined our webinar today. So this is our effort and activity to help our affiliates and our mosques to make arrangements how they can make arrangements for their reopening. I think Brother Abdullah, if I request Brother Abdullah to tilawat, will be much better, and participation would be from Aberdeen, inshallah.
Inshallah, yeah, that's no problem. Brother Abdullah, you there?
Yeah. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وقضى ربك ألا تعبدوا إلا إياه وبالوالدين إحسانا إما يبلغن عندك الكبر أحدهما أو كلاهما فلا تقل لهما أف ولا تنهرهما وقل لهما قولا كريما واخفض لهما جناح الذل من الرحمة وقل ربي ارحمهما كما ربياني صغيرا ربكم أعلم بما في نفوسكم إن تكونوا صالحين فإنه كان للأوابين غفورا صدق الله العظيم.
Jazakallah, thank you for that. All right, so just get started on the presentation for tonight. All right, are you able to see that yet? So what I'm going to do is I'm going to pass you through, so this is an agenda for tonight, sorry, and what I'm going to do is I'm going to pass you over to Brother Omar, who's going to give you an update with regards to the discussions that MCS have been holding with the Scottish Government.
Jazakallah khairan. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Wa salatu wa salamu ala ashrafil anbiya'i wal mursaleen. Sayyidina Muhammad wa ala alihi wa ashabihi ajma'in. Jazakumullah khairan. Assalamu alaikum everyone. Thanks again for coming along to another one of our webinars. So I'm going to keep it very short today, very brief, because alhamdulillah we've got a guest speaker who's going to talk us through some very important issues. And that's really the main reason why we're here. So just a quick update in terms of our meetings with the Scottish Government. I meet with the Scottish Government at least once or twice a week, sometimes it's 3 times a week, on various issues to do with when we were first going into lockdown, during lockdown, and now as we start to come out of lockdown. And those meetings cover things like our guidance on funerals, guidance on marriage, what the guidance around masjid reopening means, and practically what that means for us as a community. So really what we do is we take the guidance from the Scottish Government, we interpret that, and then we put it into kind of guidance for our masajid and for our affiliates, so that they can then action that on the ground. Through our engagements, we managed to get significant changes to the roadmap and significant changes to the legislation, and some leeway as well for certain things. And we've also been able to clarify a lot of issues as well for the community. Now, yesterday afternoon's announcement by Nicola Sturgeon actually caught everyone off guard. It caught ourselves off guard, and it caught the civil service off guard as well. That's what we understand from our meetings with them. Now, the main thing that came out of that, which affected us, sorry, can I ask everyone to mute their to mute themselves, please? There's a lot of background noise. If you can please mute yourselves, Jazakumullah khairan. So the announcement yesterday by Nicola Sturgeon, the part that concerns us is the date of the 23rd of July for the reopening of places of worship. And I'm going to be clear, that is not acceptable to us. And we will be looking for significant movement on that over the next few days. And be rest assured, I've not minced my words within our discussions and within our feedback to the relevant people in terms of how that decision was reached, what the reasoning behind it is, and if indeed it is driven by science, then it really shows the science and explain yourselves. I mean, I'm keen to keep on doing that, and I will keep fighting the corner for our masajid and for our community for as long as that may be. And as I said earlier, I don't mince my words, and I try to give the best possible representation of the opinions of our affiliates and of our masajid when I do sit in there. I mean, I personally have nothing to gain from being in those discussions and with those engagements. But as far as I'm concerned, I'm there to fight the corner for our community, and I'll continue to do that. And if there is anything anybody wants me to raise with them, if there's anything anybody wants clarification on, if there's anything that anybody wants to raise directly, then please do get in touch. Drop me a message, drop me a telephone number. Drop me a line. My telephone numbers in the bulletins that go around every month. So please do get in touch. Let me know what your thoughts and feelings are, so we can convey them back to government. So, I mean, regardless of what date the Scottish Government put out, whether it's the 23rd, whether it's the 15th, whether it's the 9th of July, one thing doesn't change, that we need to start preparing to reopen now. We've been holding the webinars for a couple of weeks now, and that's the message we've been trying to hammer home with our masajid, and that is that you need to start preparations now. The trustees, committee members, etc., we all have to understand that we've got a huge responsibility. We've got a responsibility not just to prep the masjid physically, but we also need to protect our own people, our own volunteers, our staff. We also need to protect the people who are coming to the masjid as well. We've got to be prepared for emergencies, and we've got to understand our duty of care. And the first step in that really is the risk assessment and the appointment of a COVID safety officer, which is something that, again, we've reiterated over the last couple of weeks. And that's really why we've organised today's session with Brother Shuaib, who is an expert, and I thank him wholeheartedly for lending us his expertise and his time. I pray Allah subhanahu wa ta'ala accepts all that from him. So I'll pass back to Brother Aves, our host for today, and he'll introduce our guest speaker. Jazakumullah khairan.
Thanks for that, Omar. Yeah, and just to kind of reiterate what my brother said there, basically things are changing quite quick. Yeah, so, you know, as was said there, the recent announcement caught everybody off guard, and so things are changing quite quickly. And so regardless of how quick you plan to open, the sooner you prepare, the better you're going to be. Because it's still obviously a risky thing to do, opening, you know, whether you want to open, you know, now or later. You know, there has been this talk of a second wave, and basically the best way to mitigate that and to protect your Jamaat is by basically preparing. So Brother Shuaib, who works with the MCB down in England, and another organisation. I'm going to let you introduce yourself, brother, because I don't want to kind of get it wrong. But I'm going to pass over now, and our brother's basically going to run us through the health and safety session as well as going through the risk assessment. So just let me know, brother, and I'll move the slides through for you. Yeah.
Bismillahirrahmanirrahim. Assalamu alaikum, everybody. Thank you for joining and thank you for the invite. It's my honor. I know you guys have been very kind with your words so far. It's my turn to talk now, but I'd like to say thank you very much. I'm sure everyone's on top of it already, but if you're not, there's not a worry. I'll run through what I can as quickly as possible. I don't know if Brother Aves and Brother Omar and Sister Zara will give me the opportunity to possibly re-meet again in the future if there is any further questions. But I'll just leave today some food for thought, if that's possible. So I'll begin with the first slide, and the first slide says risk assessment, content and suitability. It's at the moment, the country is worried about risk assessments. I've been working in Wales. I've been working with Mosques in Reading and Kent down south. Myself, I've actually been in health and safety for the last 6 years, and on hearing the news of the opening of the masjids again, I put everything aside, and I just said, I've got the knowledge, I've got the expertise, and I instantly heard the sounds of my father's friends who are part of committees and trustee members, and my own friends' fathers and my own friends as well, all being very confused and questioning issues around the risk assessment itself. So alhamdulillah, Allah has given me the opportunity and experience, so I put together all the necessary points of a risk assessment to make things a lot easier. However, that's to be discussed with Brother Aves on how he wants to proceed with actually distributing or assistance on risk assessments. I think we'll leave that for another time. So I'll just jump straight into it, inshallah. The risk assessment itself is not the concern for me, really. The main concern is brothers and sisters who were involved in opening the masjids all around the country, Scotland, Wales, and England, are putting together certain plans. For me, it's not the actual opening of the masjid that is the hard part. It's actually staying open. This is where my drive has come from to give the assistance, because opening and having the masjid stay open and then receiving complaints, possible complaints of brothers congregating outside from local residents or anybody in the vicinity of the masjid may trigger inspections from any local councils. I'm not too familiar how it works in Scotland, but in England, I'm a health and safety inspector for the Northwest. So any complaints would actually trigger a site visit. A site visit would then ask to see any documentations or proof. It's not so much the documentation, so it's more the proof of having all steps in place to make sure that any situation, the situation we're in now, COVID, has been thought about, all the risks that come from the hazards, have been given appropriate control measures. Don't let that worry you too much just yet. We'll come to that shortly. But my essential point was basically that the masjids, they need to do things properly. Our community needs to do things properly, so that ultimately when we do open, we don't have to close, or there's no 5 or 6 days given to the masjid to rectify certain aspects. That in itself may sound easy, because then we're getting time to rectify ourselves, but in between, I'm sure brothers and sisters will agree, it may cause a lot of bad press, look bad on our community, and ultimately for me, I can hear it already, Muslims can't do things properly. That's my main concern, my main focus. I know I was being a bit vague there with my information on what I was trying to pursue, but I'm sure you understand the points. The main thing about actually opening is the dates as well. if you're not ready, then do not open. The last thing you want to do is open the masjid because you have a date available for opening, and you've also had the inquiries for brothers and sisters who want to start either the Jummah prayer. But at the same time, you also have to look at the realism and the requirements that you need to put in place to open. One thing that a lot of masjids have told me is that obviously the funds from donations haven't been really coming through in the last 3 or 4 months. So opening the masjid, generating the funds, bring the masjid up to speed with financially is a concern. So we'll come to that shortly anyway. I'll just go into the document itself. The document itself is a legal document. It needs to be looked at by the management of the masjid, the committee members. A risk assessment itself is really the analysis, so an understanding of the negative impacts that COVID will have on the masjid. That's the risk element of the actual document. So we'll be.
You're on mute, brother.
Yeah.
Sorry.
Yeah,
Technical problems. So yeah, it's a legal responsibility. The management and the committee members need to have a look at this. They need to have a look at what is in plan, what is being put in place, what has been thought about. The actual document you can see on the shared screen there. So the first section there, what is the hazard? So we're looking at certain hazards in the masjid, and we're looking at who might be harmed. That could include not only the attendees, but the volunteers and the staff members as well. Once we've identified that, that is the first legal step we need to take. Then we need to say, right, how are we going to put in place control measures to actually be able to control what we've identified. Once we've got to that stage, we're going to take responsibility and ownership of the document and the findings and the control measures, and that's the last 2 sections there. There's things that have already been out, such as cleaning, infection control, putting posters up. So for example, brothers are not keeping a 2 meters distance. How do we put a control measure in place? We'll put banners, we'll put signs, we'll put posters, we'll put barriers. Infection control, how are we going to manage the infection control as a hazard? A control measure would be that we would then have a cleaning schedule, which I'll also talk about shortly. But those things are easy. I'm sure we've already got a grasp of those things. What I will introduce to you today is other things that are hazards, and you won't necessarily think of them as hazards, but we need to put control measures in for them. One example would be time. Time is a hazard. We have, for example, I've had news of some masjids having 3 jamaats for Jummah, 3 Jummah namaz, salahs, and that's to accommodate the number of brothers that need to come in, the number of sisters. Time is a hazard there, because what you need to do, you need to get the brothers and sisters to come into the masjid, remove footwear, then actually have the khutbah and the salah, the Jummah namaz, and then leave the masjid. Then you have to have cleaning before the next Jummah starts. That could potentially take an hour, 45 minutes to an hour. Control measures for time would be having a possible shorter khutbah. It is possible to have a shorter khutbah, maybe even smaller surahs in the namaz itself. Those are also control measures. Communication before the masjid actually opens is very, very important. That's something that needs to be addressed early at this stage. So with that, we are identifying hazards and looking at the risks they pose. There's a risk assessment. I'm sure everybody's got hold of one by now. If not, then there are plenty available. What I would say is that being a legal document, we have to ensure that this risk assessment has as many points as possible to cover you and remove any concerns. So, for example, there is the legal aspects that include looking after the welfare of the staff, the volunteers, providing them with toilet facilities. I don't know what the full current situation is in Scotland at the minute, but the general consensus is that Woolder facilities are and must be closed. However, it goes against welfare regulations, and welfare regulations do state that you must provide a toilet facility, fresh water facility for staff and members and users of the site. Potential remedy for that, potential control measure would be provided masjids have disabled toilets. There is a small sink in there as well. That's one option you can take. We've also looked at appointing duties to COVID officers and marshals. Now, one thing I would suggest is that we have to look at the welfare of the COVID officers as well. That being said, in each Jama'ah, in each Salah, there has to be at least one. Now, that one COVID officer will have to be responsible for the door, the volunteers, the staff members. That being said, that's a lot of pressure on that one person. So masjids may want to consider having more than one COVID officer, possibly one for each Jummah, so that the pressure and the stress and the well-being of that individual is under control and maintained. There are other things that you might want to look at which aren't always legal, and that's moral responsibility. Your responsibility lies within the grounds and the inside of the masjid. When attendees, brothers and sisters, leave the masjid, you also have a moral responsibility that you might want to include into your risk assessments. And that is, for example, when you leave the mosque, when you leave the masjid, you remind brothers and sisters to maintain their social distancing. They also leave the premises and leave the area surrounding the masjid as quickly and easy as possible to remove any negative impact on local residents. A few things need to be said as well in terms of actually the setup of the risk assessment. Before the risk assessment is actually carried out, there needs to be two sets of meetings. One would be with committee members and trustees. That is basically to get the go-ahead that the building is fit and proper for use, to allocate different team leaders so that we have some sort of organization before we start looking at the risks and hazards. The second meeting I would potentially have in a masjid would be with volunteers and staff members, and that would then be breaking down aspects of the risk assessment to be then worked on and made practical. Being practical, it's basically one aspect of the risk assessment. The other aspects are looking at resources. Thank you, that was well timed. Resources. Now, I know masjids are stocking up on antibacterial wipes, PPE. You have to remember that COVID is a temporary situation, semi-permanent, I would say. Reason being that the actual risk assessment itself for COVID is specifically only for COVID. I wouldn't rush into buying a mass amount of products because we don't know what the future holds. Things are being relaxed. Things may also escalate with potential more cases and therefore another second wave. That being said, we have to be realistic in how we spend and how we actually look at what resources we have to hand. Talking about PPE quickly, going back to my initial drive for all of this as well, making sure that the masjids are doing things properly, and we also are showing to the community, not just the Muslim community, but the residents of the masjid as well around the surrounding area, that we are taking responsibility over opening our masjids in a proper manner, where our brothers and sisters are looked after, and we are taking responsibility of infection control. One aspect would be wearing PPE for all door stewards to show that we are taking this seriously. It's a visual aspect. It might be something worth considering. Posters outside as well, signage, and perhaps I've heard a few masjids as well are given the understanding that if you have, before the actual masjid opens, a meeting with the local residents, invite them into the masjid or onto the grounds of the masjid and discuss with them your risk assessment, discuss with them your plans of opening and how you intend to open and maintain the congregations, and what communication you are actually giving out to the members who will be turning up to the masjid, the attendees. And also looking at communication, you might want a separate communication channel for residents, local residents. So if they do feel fearful, or if they do feel that they're being at risk by the brothers who are passing their homes or in the vicinity of the masjid, then provide them with a number, a telephone number, to reassure them that if there is any concerns that you have, that is also a legal requirement, in a sense, that you are taking responsibility for your premises, for your actions and activities on the premises. Risk assessment, the last thing, is make it site specific. Not all masjids have stairs. Not all masjids have ghusl facilities. If you have these aspects, then make sure these are included as well on how you're going to identify the risks and put control measures in place. I'll cut it short there. There is a lot more to cover, a lot of ground to cover on risk assessments. If there is any questions, I'll be open to answer them with the permission of the host. Jazakallah. Thank you for that.
Thank you so much, Brother Saib. I know we and I are going to be handling the Q&A now. So we know we have got a couple of questions in the chat, but we thought, just to make sure everyone's paying attention, we'd do a bit of interactive polling, just to see how everybody has taken the advice on board. So
it's basically a test of how well you've listened to brother.
Sure. Okay, so let's see. We'll give you maybe 30 seconds. Can everyone see the poll?
Assalamu alaikum. May I ask?
Yeah, sure, Brother Haqqani.
You have given a brief but fairly comprehensive description of what needs to be done. However, most responsibles in mosques are like me, 70 years plus, and their memory is virtually non-existent. Would you be able to provide either printed, or if not, at least electronic versions of the guidance, say on email?
I'll speak to the host on this. There is a better option, and that is I've pulled together all the potential risks, speaking to a number of masjids in England. So the risk assessment is quite comprehensive. If you can work through the risk assessment, all the points I've raised are already in there, and a lot more. There's 70 points to go through. You can pick and choose which ones apply to your masjid, but from my understanding and working with the masjids, most of them will apply. The only things you need to look at is if there is a fire exit and it leads out into an assembly point. Those kind of aspects. Some masjids, their doors open up into car parks, some open up into roads. Like I said earlier, stairs, ghusl facilities, those things you'll have to look at for your own masjid. But majority of the points are in the risk assessment that I have produced.
Jazakallah khair.
Thank you. Thank you, Brother Shuaib. I'm just going to pass Brother Omar there.
Yeah, so on the point of the guidance, we did send out our guidance with a bulletin update, which went out to all of our affiliates, and that was when we the week when we first actually talked through the 9 steps guidance. Then what we're hoping to do now is the templates and the risk assessment that Brother Shuaib has put together. We will be putting that into a Google Drive so that it will be easily accessible for everyone. So it's a case if you just go on, you'd be able to download it and print it off. make it site specific and then print it off. And then hopefully, inshallah, that should make it a lot easier for everyone.
Yeah, so and I think it's maybe worth repeating what Brother Shoaib there said as well, because it kind of mirrors my own personal thoughts, that like the people in charge of the mosque, whether it's a trustee or a committee members or volunteers, you basically have to get together. You know, you have to spend the time. You know, we will circulate the material, but you will have to kind of print it off, spend time going over it and understanding exactly what the implications are. And work, you know, like Brother Shoaib covered excellently, I felt, you have to communicate this to other people working in the mosque, and then basically drip feed those ideas to the rest of the community, starting with your Jamaat. So there's a lot of work for all of us to do, you know, and it's basically this homework. So, you know, in terms of do a risk assessment, you know, manage, you know, understand because of distance and what are the numbers of the Jamaat, yeah, you know, get those kind of concepts into your heads, basically, in terms of, you know, previously if you're a mosque and told 20 people or 100, realistically, how many people are you going to be having per Jamaat now? So you need to understand those concepts and basically build in, you know, that will dictate how many COVID officers you have or how many volunteers you need. So it's basically now we're at the point where we need to be practical. So we will circulate the material. I think it's fair to say we already have shared material that's been kind of written between ourselves. And
just a question come in. So I think two kind of critical concerns. One is, how do we manage numbers? I know this has come up repeatedly across all the webinars, but how do we turn people away? How do we, you know, how do marshals enforce things? And also regarding the risk assessment, if it is proving to be quite challenging, is there advice you have on making it quite simple? Should it be changed or reviewed, or is it just a one-time thing?
Do you want me to step in for that one?
Please,
yes.
yeah.
Yeah, okay, so going off the risk assessment itself, I have put together the most comprehensive one from my understanding of the masjids. If you just have that in place and if you just work through that with the volunteers, are we using the 9 steps in Scotland as well?
Yeah.
So with the 9 steps, the risk assessment I've produced is actually mirrors the 9 steps. So if you can put together 9 teams, the 9 teams can then work through a section each. That will take away the complication of working through a big, massive document and pulling this together. With the 9 teams, I would first initiate 9 leaders. Now, it doesn't have to be 9. One person can take 3 of those steps. So before prayer, during prayer, and after prayer can be one person. That being said, once you've got the team set up, I would then allow the team members to go and pick from their own their own local region volunteers to help them with the setup of their allocated task. And then what I would do then is within 2 weeks' time, I would sit down again with the committee members and trustees and present. So for example, for argument's sake, let's say we did have 9 leaders with their own set of volunteers that they chose. I would then go and present that to the committee members and trustees in 2 weeks' time of, look, this is what we have. This is how we intend to open the masjid. Is there any objection? Then again, you're bringing back the responsible people for the site, because ultimately, if anything goes wrong on the site, it's the committee members and the trustees that will be answerable for it. I hope that answers that question.
No, thank you so much for that. Brother Omar, do you want to add to that?
Yes, so it's just it's probably an obvious point, but it's one that we need to stress. Any meetings that you have with regards to COVID-19 control, please make sure they are minuted, and please make sure that you file them away, along with your normal filing process, but also in somewhere separately where you're recording all the measures and steps that you're taking for COVID-19 control. And that I can't stress how important it is that you make that paper trail there. You can have all the procedures in place, but you also have to make sure you're keeping that paper trail there as well, making sure everything is minuted, documented, signed, recorded, and kept safe, inshallah.
Can I just step in now? I've just got some final points to add. to the health and safety. Have we got time to just quickly add 4 points?
Yep.
Please.
So obviously BAME, is that the similar term in Scotland?
Yep.
So we've got British, not British, no, British is it, is Black and Asian minorities. Now what I would say is in England it's 65 and over are where the figures are rising. Now, that being said, with BAME communities, I would really assess who your individual communities are. That's specific to your masjid. If you find that a lot of the attendees are above the age of 60, 65, I would really put in place some legal sign-in sheet where you have like a disclaimer, or say, for example, you can have it on a poster and you point this out to every attendee. Are you happy with these site rules? That way it covers you if there is, if there is any deaths from the community. There is no way of tracing it back to the masjid, but as long as we as a community for each individual masjid are putting everything in place where it removes the liability, or we've assisted in removing the liability from the community, the committee members, the trustees, that's where I am, inshallah, in a happier place with all this. But that's my main goal in England especially. The second thing I wanted to bring up was temperatures. If you have a temperature machine gun, are you going to temperature control every single person, all 150, 75 attendees that come in? You have to think about time, if you remember the time factor from earlier. If that is the case, then that's good for you guys to do that. However, what I would suggest is that you look at the other aspects of COVID, and if there is a concern with anybody on site, then take the temperature, get everybody into the door, get everybody taking their shoes off into carrier bags, get everybody to put their masala down, the prayer mat, get everybody to settle, listen to the khutbah in Jummah, do the salah, and then in an orderly manner give the instructions of the site and let the brothers and sisters leave. The last thing you want to do is add complication on the door. We want to keep this as simple as possible. Same with the risk assessment. One's already produced for you, just use that. Get the masjids open. The next thing I want to come on to quickly is the capacity. I know there's been a few capacity. Just reading that question there as well. Yeah. What I would suggest is getting a pack of A4 paper and put each sheet on where you think the prayer mat should be. That way you can have a visual look and a visual understanding of how much your masjid holds, because I've seen some masjid, they've been taping up the masjid, but then I've gone in and I've said, right, where do we walk around? Or how did you calculate this? And what they've done, they've got a calculator and they've worked out 25% of the actual capacity of the masjid. But realistically, if I've got a capacity now, a new capacity of 25% of maybe 150, I need to take at least another 30 of that as well for movement, for ease of traffic through the door, for waiting outside. It has to be realistic. So I wouldn't go marking as it's a waste of materials and resources again. I'd use a pack of paper, lay them out where you think the masala should sit, have a look at it, walk around, take an hour, and then tape the carpet up before you actually work out the full capacity. The last thing I want to just mention is volunteers, that Sister Zara mentioned earlier, that the actual recruitment drive is what needs to be thought about now. There is, in the 9 steps, a section on staff. There needs to be a dedicated person looking at that on Facebook weekly, making sure that the numbers of volunteers are there for the masjid, because we have to also consider if we have 150 people coming through the door, 3 volunteers, it's not going to be easy to do. Is that the masjid closing again because there's not enough volunteers? Nothing to do with COVID. Those kind of things will again bring bad press to the masjid. Yes, there's a lot of thought there. Like I said to you, just all food for thought. Inshallah, if there is further questions, I'll pass back to the host. Jazakallah.
Thank you so much, Brother Shoaib. I think really a lot of integral points. We got this question from Facebook, but the information actually is available in different languages, so all the posters have been translated. We'll share the link of that on Facebook and on our emails. I think I'm just going to bring Omar in just to maybe conclude things, unless there's any other questions that anybody would like to ask. And there's been quite a few questions, Omar, on congregational prayer and 2 meters and when is it going to happen. So I don't know if you want to pick up on a couple of those points and then maybe just wrap up.
Okay, yeah, so the only thing that's been announced just now is that provisional date of the 23rd for mosques to be for mosques to be able to have congregations. So aside from that, there's not been any other announcements with regards to either the 2 meter rule or any other measures being relaxed. I mean, as I say, as things stand, we're still looking for clarity on certain issues, and we're still pushing back on this date that's been put out as the 23rd. The only thing I can really say is just kind of keep looking at our affiliates WhatsApp group, keep looking out for our emails and our updates, and inshallah, as soon as anything comes through, then we will make you aware of that. And anything else that we feel as our discussions are going on, you need to be made aware of. Inshallah, we'll continue to make you aware of those as well. In terms of, as we said, the capacity, the percentage actually that we were looking at was around 15% when you take into account things as Brother Shoaib has mentioned in terms of entrances and exits. But even that, it's not set in stone. It's going to depend on your own hall and how you're able to put those entrances and exits in place, whether you're going to have a one-way system and how people are going to actually kind of stand in the hall as well. So there's a lot to consider. And alhamdulillah, Brother Shoaib has given us a lot of food for thought, a lot of things to think about, but also a lot of practical solutions and a lot of extra considerations that we may not have thought of. The important thing now is that we start to put in place the measures that we need. That starts first of all with putting together the right team, appointing the COVID safety officer, and getting the risk assessment started in terms of making it site specific, putting your teams together, and then starting to work through your hazards, making sure you're ticking them off one by one, and then making sure everything is recorded and putting in place the measures that are necessary for you to open. And the last thing that I would say is actually the first thing that Brother Shoaib said, which is something that we've been saying for the last 2 or 3 weeks now. If you feel you're not ready to open, then please do not open. Do not give in to the pressure from the community to open if you know that you're not ready to open. It is absolutely imperative that we keep each other safe, that we keep our musallis safe, that we keep our volunteers safe, and that when we open up, and when we open up, it's not just as a trial run, that it is as a long-term thing, as Brother Shoaib said, that we're looking to open up and we're hoping not to have to close it again, and also making sure that we are communicating those messages to our musallis. And the most powerful way actually of doing that, as I said in earlier webinars, is to actually, once you've got your measures in place, is to make that walkthrough video from pavement to pavement. This is what to expect when you come to the masjid. This is what we expect from you as well. So people know exactly what they're coming, what they're getting, what's happening at the masjid, how they have to come in, how they have to react and behave within the masjid, and then how they can leave safely as well. And I think if we're able to do that, inshallah, then we'll be able to open the masjids and inshallah keep them open with the right safety measures in place.
Thank you so much, Omar. And we thank everybody that's joined us here today. We know that there's lots of webinars going on and there's a lot of information, but really this is a brilliant opportunity for you to come along and ask your questions and also share some of the good work that you're doing. Now, we are recording this webinar and live streaming it, so we will share it, and we are working in close collaboration with the Muslim Council Britain, the Muslim Council of Wales, and the British Islamic Medical Association. So we understand that this is actually a much bigger project than just a mosque reopening. There's so many different factors to consider. We also understand it's quite daunting. If you're the paperwork, the liability, the risk, and more fundamentally turning people away, which I think none of us really want to do, but always keep in mind this is a public health issue. We need to keep people safe. We need to ensure that our community isn't wrongfully blamed. And also, studies show that we are disproportionately affected, so we do have a real responsibility. And from all of us at the Muslim Council of Scotland, thank you again for joining, inshallah. We're happy to help and support, and even on a one-to-one basis, so you can get into contact with Brother Omar, who's the head of the Muslim community. We thank our special guests from London, Brother Shoaib, who has travelled so far. I'm sure it's been quite a long journey all the way up north in Scotland. We hope you've had a pleasant trip. And the points are across the board, they're consistent, and fundamentally it's trying to do our best and constantly changing it, evaluating it, but communicating as a board. This isn't going to be on one person, it's all of us as a community and as a team. So from all of us at the Muslim Council of Scotland, thank you so much. We pray Allah accepts our efforts and guides us to success in this endeavour, inshallah, ameen. Thank you so much. Assalamu alaikum.
Welcome.
Bye.